Samantha Power there. Well, Dr. Zaher Sahloul is the president of the Syrian American Medical Society and, as I said, was one of the doctors who presented the evidence of the attack to the Security Council. Thank you very much for joining us. Now, I understand that the testimony that you and your colleagues gave was incredibly distressing, but can you just recount some of what you said?
Well, thank you for having me. And yesterday was a special day for many Syrians, especially Syrian doctors who are trying to deal with this horrible situation where you have patients who come to you in droves. Many patients came on March 16th to a small hospital in the city of Sirmin who had symptoms of exposure to toxic agents. They all had shortness of breath, cough, wheezing. Some of them had fluid in their lungs, and some of them unfortunately died. There was this family of, the name of the family is Talib. The three children, Muhammad, 1 year old, Sarah, 2 years old, and Aisha, 3 years old, their parents and their grandmother, all of them were living in a basement. When the barrel fell in the ventilation unit of the basement, they all inhaled high concentration of the toxic gas. And when they brought to the hospital, they were all either dead or dying. And the physicians and the nurses, with their limited resources, tried to revive them, but unfortunately they failed. And this is only one attack out of 6 attacks that we detailed to the Security Council members yesterday. And clearly, most of the ambassadors were visibly moved by the testimonies, by the video that you have mentioned.
Now, as you say, this isn't the first attack. It certainly won't be the last. Just how frustrated are you that this continues to happen?
Every Syrian, every humanitarian is frustrated that after 2 years from the beginning of these attacks with chemical weapons in December of 2012, and after everyone thought that we ended this after August 21st, 2013 with the Ghouta massacre, and that led to the destruction of most of the chemical weapon in Syria, now we have to deal with other series of chemical attacks now with chlorine. Now, this toxic agent was used last year, and that was the basis of OPCW investigation in Syria that confirmed that chlorine was used systematically in Syria. And the Security Council had a resolution a few weeks ago only condemning the use of chlorine and saying that there should be consequences of its use. And now we have these series of attacks in small villages in Idlib. Definitely this is inhumane and horrifying way to die when you are in the middle of village or city in Syria and you see your children suffocating to death in the middle of the night. Everyone should be moved to action. And yesterday there was a lot of call for action. The UK ambassador was clearly moved, and he was crying, and he said that this should be a stimulus to the council to move not only to have investigation but to try to stop the killing. Yes, there should be accountability. The word accountability was used like 10 times yesterday.
I appreciate that, but the point is that we've heard this time and time again, and yet the problem seems here that can you directly lay the blame at somebody's door?
This is not my role, and this is not the role that I envision to myself. I'm a physician. I traveled to Syria last week to talk with my colleagues and to see what is happening. I have no doubt in my mind that a chemical weapon attack happened in Syria in the last few weeks. I have no doubt in my mind who is the culprit. And everyone in Syria think that the Syrian government is using chemical weapon against the civilians. But it's up to the international community to take this issue seriously and move to stop this horrendous killing.
Indeed. In terms of the international community, I know that you've been speaking to the Russian delegation, which has finally, it seems to be moving its stance against President Assad. What was the conversation that you had with the Russian delegation?
We had a meeting with members of their delegation today, and they insisted on the fact that the OPCW should have an official investigation with the cooperation of the Syrian government to collect evidence and to take care of the technical issues. They were not sure who is the culprit, and they think that it is doubtful that the Syrian government has done that. Of course, every other Syrian that I've spoke with disagree with that statement. Everyone in the city of Sarmin said the same thing, that they heard a helicopter, then a barrel was dropped, the barrel did not explode, then people started to smell a bleach-like odor, which is similar to cleaning liquid material, and that's consistent with exposure to chlorine gas. And then you had many people coming to the hospital with same symptoms consistent with exposure to choking agent. And this is, to me, as a physician, as a critical care specialist, is a clear evidence of exposure to chlorine gas. And only the Syrian government and the Syrian army have helicopters.
Okay, well, for the time being, Dr. Zaher Sahloul, thank you very much. And I guess the problem is it's laying the blame at President Assad's door that will hold the international community back somewhat. But for the time being, thank you very much for recounting that very difficult testimony. Thank you very much.